But first, more concern tonight, not just about the use of hormone treatments and puberty blockers on children in the public health sector, but also the rise in privately prescribed treatments for young Australians identifying with gender dysphoria. In a recent and contentious review of the Queensland Children's Gender Service, it was found that 45% of the children and adolescents who'd been prescribed puberty blockers were commenced on them elsewhere. Now, elsewhere means they were privately prescribed. What's more, the same report found that on a per capita basis, there's been a more intensive use of puberty blockers in a single Australian state than throughout the whole of England, where their ban, of course, on puberty blockers was last night upheld in the High Court. For more on this, let's bring in someone who's been brave enough to speak out publicly on criticisms about gender medicine in Australia. She's an expert, senior child psychiatrist, Dr. Jillian Spencer. Well, Dr. Spencer, thank you again for your time. I think this is such a critically important area, and my audience and people who watch everything you have to say online are hungry for information. We'll get into criticism about the Queensland review in a moment, but let's start with the use of private blockers, of hormones and puberty blockers prescribed via the private health sector. How concerning is this?
It is a very concerning revelation, but we have known that this is coming because last year the hardline gender activist clinicians updated their so-called Australian standard guidelines to allow general practitioners, GPs, to prescribe cross-sex hormones to children without those children going into a gender clinic. And at the same time, the Royal Children's Hospital in Melbourne did a media campaign where they sent their child and adolescent psychiatrist from the gender clinic out into the media. And what she said was that she hoped that children would be able to get gender hormones from their GP, much like children get vaccinations from their GP. But what this Queensland evaluation report has revealed is that there's a group of dodgy doctors that are actually going beyond the recommendations, the activist recommendation guidelines, and they are not only prescribing cross-sex hormones, but they're prescribing puberty blockers from their private rooms. And in terms of regulation, there is none. There's no oversight. And unless we get government intervention, all we can do is try and get accurate health information into the hands of parents. And what parents need to know is that there's no evidence that puberty blockers or cross-sex hormones improve psychosocial outcomes in children with gender dysphoria. They don't reduce the risk of death by suicide. They lock in the gender dysphoria and make it such that the child doesn't recover naturally from their gender dysphoria through the course of adolescence. And they have very serious long-term health implications like infertility, lack of sexual function, physical health problems, and the risk of regret.
I just think it's extraordinary. I mean, anytime you go to a doctor now, Jillian, they send you away with 15 bits of paper to go off to specialists and, have this test or have that scan. So the idea that a non-expert GP can prescribe something as life-changing as this, I think that's a worry. I think that's a revelation to a lot of people watching tonight. We know there's concern in the health sector because big insurers, MDA National is a good example, well, they're dumping cover for these practices. I think they're worried, and we've seen this in the United States, that there could be a comeback in terms of legal actions from people should they detransition.
Yes, well, what practitioners in private understand and believe about gender dysphoria is dependent on their sources of information, and practitioners working in private usually don't have access to the university research databases that allow you to go and look at the original research studies, and they also don't have time to evaluate all the treatment recommendations. So instead they rely on knowledge summaries that are produced by their local hospital network or health network, or position statements of colleges, or treatment guidelines. And what we know is that in this area, all of those sources of information are heavily influenced by activists. And the research in this area, it's a very sad state of affairs. What we have is researchers that lie about the findings of their studies, and then those lies are repeated in other articles. So what you end up with is lie upon lie upon lie. And in terms of the research for gender medicine for children, it's actually just a refuse heap.
Let's just stay with the quality of research, because we saw the big CAS review out of the UK, hugely significant, very comprehensive. It's led to a ban on puberty blockers for children in that country, upheld, of course, I said last night, in the High Court. We've had a review in Australia, we've had one in Queensland. This is in relation to, gender policy in that state. I know you've been stood down from the hospital up there because you've advocated care. You want a fair income review. You don't think the review by the Queensland government has been impartial. What can you tell us?
Yeah, it wasn't impartial. 4 out of the 7 panel members were known advocates of gender-affirming care, which means that what's happened is that they've failed in their major task, their most important task, which was to ensure that the model of care for the gender clinic going forward was safe and evidence-based. And they haven't done that. They've recommended that the paediatric gender services in Queensland continue with an affirming approach. But when you look at the 25 recommendations made in the evaluation report, you can see that they're trying to fix a clinic which is in crisis and providing a very poor standard of care for patients. So the recommendations are targeted at problems like that the clinic is professionally isolated from every other medical service. It's not being overseen by very important quality and safety networks like Clinical Excellence Queensland. It's not doing adequate, it's not giving information, communication with referrers is inadequate. It's not doing good handovers when it discharges patients. There's a lack of clinical leadership in the clinic, and they're not doing any monitoring of long-term health outcomes for their patients. So it's just concern after concern after concern, and it paints a very frightening picture. And the other thing the evaluation report does is talk about how it's actually a nightmare to work at the gender clinic. So it talks about staff being very stressed, burnt out, feeling constantly under scrutiny, and feeling like they're subject to reputational risk from working in the clinic. And so that's led to some bizarre recommendations. For example, they want to hire a consultant to figure out how to boost morale in the clinic. And they want to do a public education campaign where they try to convince Queenslanders that they shouldn't be concerned about these harmful gender interventions being provided to children.
Well, we know around the world they are. We are indebted to you, Dr. Spencer, for shining a light continually at risk of your own career on this issue. Thank you for your time tonight.